future cities. This event is part of the conference cycle from the Kamolvej 2021 and co-organized by the Embassy of France in Thailand, the French Research Institute on Contemporary Southeast Asia, or Irasec, Urban Design and Development Center, Chulalongkorn University, or UDDC, along with Thai Health Promotion Foundation. And today is the last day of this two-day conference running through 16th to 17th of December. Broadcast live on Facebook page and YouTube, UDDC, Urban Design and Development Center. And today, our expert panelists will walk you through three different dimensions of multidisciplinary integration of OneHealth concept. First, the topic of climate change and heat, Thailand perspectives by Associate Professor Kraichat Tantrakarnapa from the Department of Social and Environmental Medicine, Mahidol University. Second, Rethinking Cities in the Pandemic and Vulnerability Era by Mr. Pongsak Yingchoncharoen, Mayor of Yala City Municipality and President of National Municipal League of Thailand. And last but not least, Making Collaborative Health Governance Work Better in Mega City, Bangkok, by Associate Professor Tavida Kamolvej, the Dean of the Faculty of Political Science, Thammasat University. And Professor Yingchoncharoen will be our moderator for today. For all audience, please feel free to leave your question in the chat box. The Q&A part will be held after our expert panelist presentation, especially if you have the question for Mr. Pongsak Yingchoncharoen. Please leave us the comment because he might have to leave sooner. Let us now start our program by welcoming Professor Yingchoncharoen. Please welcome.
Hi. So yeah, thank you so much, Kun Nurse. Let's get this conference started. Let's invite Professor Kraichat Tantrakarnapa to start off his talk on the climate change and heat, the Thailand perspectives. Please go ahead.
Thank you very much for moderator Ajahn Wan. And first of all, I would like to thank you, the organizing committee, to invite me to join and share your conference. Let me start to share my screen first. I think now is okay. You can see my slide. Can you see my slide? Okay,
yes,
I will make full
can.
screen. Yep. Thank you.
All right, that's perfect.
Okay. Okay. Yeah. The topic is climate change and heat, but not only heat. We have to think about the consequence after we exposed to the heat for Thailand perspective. Right now, I'm working at Faculty of Tropical Medicine, Mahidol University. My interested research topic are linked to climate change and also the air pollution and the health impacts, including in general and mental health and management. This is the outline of my talk. First, let's introduce you about the situation of climate change, both in the global level and also the Thailand situations. And then how about the climate change and what are the response from Thailand government, particularly for the involved organization. We initiate the climate change master plan, and then we use this one to transform from policy in international, national level to local level, like regional or provincial, or even though in the communities or even village. And the third one about the health-related issues linked to the climate change, not only the heat. And the last one, how can we survive in the change of environment? Like we need to adapt the society and ourselves for the change we call National Adaptation Plan. And I will focus about the public health issues from National Adaptation Plan. Okay, first I would like to mention about the climate and weather because some misunderstood about two words. For the climate, if we use the word climate, we have to talk and mention it's longer term, like maybe 30 years in average. The thing that we expect, for example, okay, how about 2030s? How about the weather in Bangkok? How about the weather in Thailand, right? But for the weather, it's just what actually that we get for a daily basis. Like we talk, oh, today, this morning, Bangkok, the weather is quite nice because early morning, average temperature is only 25 degrees Celsius something. But if we talk about climate, we need to mention time series, longer term. You can see from this graph, we obtain from many satellites and the sources from NASA, from NOAA, or bigger Earth, the source of data. You can see from this graph, we start to take a look back from 1850 until 2021. You can observe at the early state, the temperature is quite stable, even though it's fluctuated year by year. But after 1925 or something, yeah, approximately, you can see the growth of temperature is sharply increased. That means it's quite different from the previous period. And what are the sources of the change of temperatures? You can observe from the light graph for the source of carbon dioxide that link to temperatures. The gray colors, this is the source of greenhouse gas like carbon dioxide emissions from anthropogenic source. That means from human activities. The gray one, but for the brown one is also anthropogenic, include the natural sources like from the forestry fire. Every year we can observe from many countries we have been faced from forest fire due to the heat or due to the dry period. And also the change of the land use and land cover. I mentioned the land use, but we have to think the land cover also. For example, in Thailand, we classify this area as, is that the paddy field only in the wet season, but the dry season, it might be not for rice planting or paddy field, but it might be a dry rain and cause the problem of the fires of the burning of biomass after harvesting. Yeah, this is the cause and link to the increased temperatures and increased carbon dioxide in the air. This is the source from IPCC. And for the heat cases, this is the hot stream event. IPCC also report about the regions that has a problem about the increased temperatures. You can see many regions, I can say that almost of the regions in the world has been facing with the high or less temperatures. You can see from the brown color, but for the gray one, we didn't have information or maybe limitations of data available in the database. And in case of our country, Thailand and our neighboring countries in Southeast Asia, you can see we are in Southeast Asia. It already indicates that the temperature in our region is already increased. Not only for hot stream that link to the climate change about the flood disaster, about the drought event, also has been raised from many organizations and also publications. And for the Thailand perspective, I asked the data from Thailand Meteorological Department. You can observe from 2 years only 10 years of difference about in 2009 and 2020 from January to June. You can observe easily from the colors. In January, in 2009, majority of the color is green. But in 2020, some part of our country changed from green to be yellow. And for February, March, April, May, and June, you can observe it changed, even though it's the yellow color, but yellow that already changed to be orange. The colors indicate if yellow color is about 36, start from 36 degrees Celsius. But if it indicates the orange one, we count from maybe approximately 49 degrees, 46 degrees Celsius. Yeah, this is the change. And if we take a look at the second period of the year from July to December, we can observe, obviously observe from the second period of the year, like in July, in August, you can see the extended yellow colors. Only 10 years, yeah, we can observe from this. And if we take a look in detail for each month, like in March, from 2009 to 2020, the maximum temperature was observed in Lampang. So you can see here at the 41.5, and is increased in 2020, but it's a different location. For in 2020, we observed in Tak province with 43.2 degrees Celsius. And in April, also similar to the month of March, 42.7 in 2009, and 44.2 was detected in 2020 in the same province of Tak. For June and July, normally if we take into account in the history, these 2 months was identified as the wet season or rainy season. But right now, you can take a look, the colors change from green to be yellow or orange in some provinces. And from our like the royal ceremony for the starting period for paddy field, you can observe we have a day to start to indicate the rainy season. But normally it's what declared in May, and now in May. But now you can observe, oh, now it's May. It's hot, very hot, and the rainings it start to be happen from the last 2 or 3 years. Maybe start from June or July, according to might be influence factor from the climate change. Yeah, you can observe from this. And this is in the city of Bangkok. I show you with a 2 graph from the left side from 1943 to 2018. This is the average temperature, monthly average for Bangkok. We found the maximum temperature was occur in April every year. But the mean or average is in between the minimum and maximum. But for the right side, I use data from the Thailand Medical Department from 2010 to 2020. This is only one station from Bang Medical Station. We observe the maximums was detected in the same period, in the same like in April, but for average temperatures is quite close to the maximum temperatures. The pattern is quite similar from the left side, from the right graph. This is very, very interesting one that we need to investigate in terms of research. what will be happen if we expose to high temperatures like 40 degrees Celsius, or even 35, start from 35 in some region. It might be trouble for local people. For example, in the southern part, normally the gap or the difference between maximum and minimum of temperature in southern part is quite smaller compared to the northern part. In the northern part, a lower temperatures or minimum, some year it close to 0 degrees Celsius. But for the summer period, the maximum can be maybe 43, 44, as I showed from the previous graph, like in Lampang or in Ta, in upper north of Thailand. The gap is quite big, about 40 degrees Celsius compared to the south. The south, the average minimum might be only 20, but maximum not more than 35. The gap is only 15 compared to the north, 40 degrees Celsius. This is very interesting. We need to investigate what will be happen in terms of local people and their health. Okay, this is the monitoring from Department of Health, Ministry of Public Health. Every year we have to monitor about the temperatures during the high temperatures. We need to monitor to get information and involve organization and local people. How can we survive? How can we adapt to stay or to survive in that situations? You can see, as I mentioned, the north of Thailand is quite critical. Like this graph, the color is not so good. I may change the color. Yeah, you can see at the third week, we start from 27 February until mid of May. This one, we observe in Ta 42.4 degrees Celsius in 21st March and 2021, this year. And for this one, we use informations, infographic to inform local organization, local people to take care of themselves. If temperature is over 40, that means it will be harmful to our health. You need to stay in the safe zone or comfort zone, like live in air conditioned room, not go to open areas, not do exercise in open air, or maybe you have to spend your time only a short period in working out of your room or your home. This is to be used for morning. And in the second period, we also observe in Mae Hong Son in the north of Thailand, 41.1 degrees Celsius. That means it's harmful to our health. And for the third period, we also observe in Lampang province with 41.6 degrees Celsius. And very interesting one, we observe that in robberies also we found maximum temperatures with 41.7, higher than Lampang, slightly higher than Lampang province. But compared to the southern part, as I mentioned, the blue color, and the right blue, you can see is quite different between two regions, southern part and the north. For northeastern part, it's also high, but compared to the north, slightly lower than the north of Thailand. And what are the health impacts from the heat exposures? This is from WHO information, just inform us. If we take a look in this infographic, the impact of climate change on human health, there are many aspects. both acute and maybe take longer time to get, for example, if we mention about malnutrition, or if we mention about respiratory disease or cardiovascular disease, something, we need a longer time for exposure. But for the heat, it might be acute immediately if you expose for longer and longer in the open air with high temperatures. This is the information from Department of Health, a unit of health impact assessment. They did a survey this year. They also survey every year, but for this year, the survey conduct between 8th of March until 16th of May this year. Number of respondents is 283. We found they have concern and awareness about the high temperatures and linked from the climate change. Many of them mentioned, oh, it's quite serious. With about 11%, they said quite serious. They have more awareness on that. If we take a look for the level moderate, more and maximum level of concern is more than 70%. Only 8% approximately, they did not concern about. They think, oh, it's far away. I didn't get any impact from that. Concerning for the age group, I think the working group from 25 to 55 years old, this is the majority for working people. We observe more than 70%. They're concerned about this one. And for the place of the staying during the high period of high temperatures, like from 8 a.m. to 4 p.m., the place that they prefer to stay, they mentioned, okay, I like to stay at the comfort zone with air conditioner, about nearly 70%. But many of them, they could not spend their time in air conditioner room. They have to stay, they have to survive in open air without air conditioner, nearly 30%. And 3%, they have to work in the open air due to their occupation, due to their job. And what are the symptoms if we expose to the heat? I think everyone, you can observe by yourself, you can perceive by your own. When you go outside during the lunchtime in a summer period, in April or in March, May, you might get the HH. This from 283 people that's mentioned, 30%, they said, yes, I have a problem of HH. But for the heat cramps, they said, okay, about 12%, they have a problem. And red skin syndromes, about 5%. Some people, they said, oh, it's too hot. I have a problem with my health. I feel that dizziness, confusions, and also have a headache, nearly 17%. Some, they said, they have a problem with fatigue, nausea, vomiting due to high temperatures, about 8%. Some, they have a problem of gas, about 5%. Heat lash, yeah, you can see if you go outside or do exercise in open area. Like myself, when I did the exercise in open area, I observe that after the exercise period, I have to take a bath immediately. Otherwise, I will perceive that the heat rash might be happen. I have to visit the doctor to talk with them. This is what happened to my body because I exposed to the heat. Yeah, from the survey we found that 14% approximately they have a problem with the heat rash during the high temperatures. And we also observe the fast heartbeat. I think many participants, you can check yourself, check your health, check your body, because if you wear smart watch, you can observe, because they will remind you, okay, now you have a problem if you didn't stay or take a rest because you exposed to high temperature or because you did more exercise. The respondent, they mentioned about 70%, 7% they have a problem of fast heartbeat. And some they say, okay, after the exposure to high temperature, I got a fever, a high fever. That means more than 37.5 degrees Celsius. Our body is about 4% from that. This is a symptom from the survey, from the respondent dimensions. We need to investigate more because from this year, we got the response only quite small, only 283 respondents. And for the heat exposures, it will be the risk factors. But the risk factor depends on what are the factors. It might be depends on your age, like baby or elderly people or pregnant women or congenital disease, or someone they have to work in the outdoor, like the worker or labor or farmers. They have heavy physical activities. This is also a risk factor. And some, they got the medicine from the doctor. Medicine treatment also one risk factors. We need to concern if someone got the treatment from the doctor or medicine, you have to consult the doctors how to prevent from the heat exposures. Important one is individual behavior, like, oh, you like to do exercise in the open area, cycling, jogging, or climbing to the hill. You need to be careful due to dehydrations. For many like sector for army, a new soldiers that come to be soldiers, we have to train them. In the past, we can train them in the open air for longer, maybe a half of the day. But now, under the regulations, according to the exposure of heat and might cause the impact to the soldiers, I heard that they also set a regulation for doing exercise or training in the open air should be limited, not more than 1 hour or something, because heat exposures. And the other factors like socioeconomic factors, the poverty, because we have to stay in the house, and you can see from the right sides, you have to stay there. How can? This is from poverty. We can observe during the summer period or dry period at the many department stores. You can also, oh, it's crowded because the people, they want to spend their time to explore the cooler temperatures with air conditioner in department, and the department not in the house with hot temperatures. The housing characteristics also very important. Due to the poverty, due to they cannot have a budget to access to buy air conditioner. The housing condition also very important. Air pollution is also a factor. We can observe after, I think maybe by the end of this month, you can observe, you can perceive about particulate matters PM 2.5 in Bangkok. There's also factors that might increase the impact to our health. Indoor air quality is also one factor. And the health service, even though Thailand has been classified as a good country in terms of the public health facility or service, but in some region or some part, like particularly in rural area, local people, they cannot access to the health service. This is the factors. And how can we take care of our health? Refer to the heat exposures according to health exposure. For the symptom of rash, you can observe if you have a baby, right? How to prevent it. Stay at the comfort zone, bathing, proper dressings, and taking medicine if it's necessary. But I recommend you, we need to consult the doctor first. The symptom like heat cramp, how can be prevented? Drinking mineral waters, because it might a problem of dehydration. You can do the light massage for the patient or the people that they have a problem of heat cramp, stretching. For the heat edema, you need to take a rest and sleep with elevated legs. In case of heat symptom, important, but you need to take a rest in comfort zone with a good ventilation. I use the comfort zone. That means it should be good ventilations and proper temperatures. We can install with air conditioner or something like that. Right now, I heard that the Ministry of Public Health, they try to provide a comfort zone for like the health service in sub-district level as much as they can, particularly for community. They have a vulnerable group like elderly people, a pregnant woman, or baby. They can inform them, okay, now our health center, we can provide this. You can come, you can stay during the high temperatures in dry seasons, in summer seasons. For the heat exhaustion, yes, don't stay outside, just stay at the comfort zone. You need to take a bathing, spray with the cold waters, proper dressings. And the heat stroke that will be harmful compared to heat exhaustion. We need to convey the patients to the health service or hospital immediately, but we need to perform the first aids and taking off the dress and wear as needed and call ambulance or deliver them to the hospital immediately as fast as we can. I already mentioned about who are vulnerable groups with the baby or child under 5 years, and the people who love like the open air exercise, open air activities like cycling, jogging, climbing, rowing a boat, many activities in open air. Or the people that need to work in open air, working like labor, the policemen, the farmers, and pregnant women, because it might cause to the babies. This is the vulnerable groups, including the disabled people who have to stay at their home or lying on the bed. We have to take care of them during the high temperatures or in the summer period. For our government, Thailand Climate Change Master Plan is initiated, and we start to implement it for 2015 until 2050. It can be classified into two categories. The first one, is it possible because climate change is so linked to the greenhouse gas emission, carbon dioxide in atmosphere, increased temperatures. If we can reduce greenhouse gas emissions, we can help our ecosystem, we can help our people. Our government, Thailand Master Plan, we use DPSIR models. DPSIR stands for Driving Pressure State Impact of Response. Driving, for example, the growth of economics, the growth of the countries. We need to increase GDP. The pressures like the more people we have increasing population, the more people, that means the more consumption, the more production. What will be happens after production and consumption? There will be the rest of that we have to dispose or dump to environment that change the state of environment. And environment provide everything for us. Environment is also the sink. It changes. That means we live in the changed environment. We expose to many things that cause impact to our health, human health. Then we need to respond. How can we do? This is possible to reduce greenhouse gas emissions for our own countries. From COP26, I think everyone know about the COP26 in Glasgow, just finished in October. Many countries just say, okay, my country will set the goal in 2030, 2050, our countries will be neutral countries. Yeah. Thailand also, we have to pray how can we reduce greenhouse gas, how many percent that we can reduce. But now, many scientists mentioned from the report of IPCC in AFI and also in the text of AI6, also mentioned about increased temperatures from 1 degree Celsius, 1.5, and they also use a model to see the many scenarios of RCP, 2.5, the change in temperatures. What will be happened? If it's true, we have to stay in that environment. We need to adapt ourselves, our society. How can we survive for the change of environment due to the climate change? In this master plan, we classify for emissions, mitigation measures, and also adaptation measures, including public health. We need to adapt for the change. For Thailand Master Plan of Climate Change, we have 3 pillars. I mentioned about mitigation measures, try to reduce carbon emissions from various sectors like energy sector, agricultural sector, waste sector, and also industrial production sector. How can we increase the carbon captions, right? The forestry. For the second pillar is adaptations. How can we survive under the climate change? Agriculture, we have to change a lot because there might be a shortage of waters. Tourists also, we need to adapt. An important one to respond for the mitigation measures and adaptation measures is capacity building. How can we give awareness to people? How can we have the knowledge for our people to respond for mitigation measures, adaptation measures? For example, we have emissions of greenhouse gas in terms of carbon dioxide equivalent. This is possible. We have a technology to capture carbon dioxide for further uses. This is capacity building. We need manpower. We need a technology. Important one is we need a budget for that. Adaptation also. We need to distribute information and knowledge to people to be aware. For involved organizations, both national level, regional level, provincial, and community level. This is the pillar for master plan. And from the master plan of climate change, we also initiate the Thailand National Adaptation Plan with the visions of Thailand is resilient with adaptive capacity to climate change impacts and move forward sustainable development. Yeah, from this, because right now UN mentioned a lot about SDGs for 17 targets. If we need to live in this society with good health and well-being, as mentioned in target 3, we need many facilities of environment to support this one, like target 12, target 11, target 5. And from the Thailand National Adaptation Plan, we classify into 3 periods with 3 missions. The first one, to build climate resilient development in all sectors at all levels, as I mentioned. And the second, to strengthen capacity and awareness at all levels. Now we have, but how can we strengthen more capacity and more awareness on these issues? And the third one, we need to develop a database, research, as I mentioned, knowledge and technologies to reduce greenhouse gas emission as mitigation measures. And how can we survive with adaptations? We did more research. For period of implementation, at the first period, 2018 until this year, 2021, this is the preparation period. We have the foundations, laying policy level, pushing to actions. From the first period, the outcome is we can identify vulnerable database. For example, we create risk mapping for vulnerable in each region, in each province, and subject to initiate and launch for National Adaptation Plan. For the second period, now we have a plan already. We need to start to implement from 2022 to 2026 for about 5 years period. Need to implement it, developing mechanisms. How can we respond from the action plan? How can we do the capacity building by our own? Or if we need some help, some support, like technology from international organization, we can do. And the last period of National Adaptation Plan is 10-year period from 2027 to 2037. This period to monitor that we can achieve our goals, achieve our plan or not. We already create an indicator. We have to monitor one by one about KPI. Number 1, KPI number 2, can we achieve or not? What are the constraints? What are the limitations? What are the obstacles we could not achieve the goals or indicators? Yeah, this is monitoring period. And this is the impact and also National Adaptation Plan we create for the impact and classify into sectors with 6 sectors: public health on the right side, you can see here, as I mentioned, not only the heat exposures, but the consequence of climate change, there might be more than that. I mean, the disease, both infectious disease and non-infectious disease, like air pollution exposures. From this, we already create the community level, community-based adaptations as pilot projects in some provinces that hosted by Department of Public Health, Department of Health, Minister of Public Health. In some provinces, join hands together. An important one, not only respond from that, but we have to think precautions in terms of proactive principles, because the modeling of climate change, we can predict, we can forecast it. Like about next 5 years, what will be happen for temperatures in Thailand, in our society, in this province? How can we do? How can we respond? How can survive, particularly a vulnerable group? This is from National Adaptation Plan classified.
And Ajahn Ka, may I interrupt you, please?
Yep.
I am so sorry, but I'm afraid we have like 5 minutes left for your presentation.
Yeah, this
Thank
is the
you
last.
very much. And sorry for interrupting.
Yeah.
Thank you.
Yep, thank you. From that, the Minister of Public Health already launched the guidelines or roadmap for action plan response to climate change and public health. For the first period, will be start from this year until 2030. And from the action plan, we also create the action plan for community-based as a pilot project on climate change and public health. And this is for next year in 2022. Yeah, this is the response plan. And from myself, now I am, according to be lecturers in university, not only for teaching, but we also doing a research. This is my research project that linked to climate change under the collaboration with Australia, Japan, and Thailand under the Asia project. Our title of cooperative research project is Climate Change and Human Health in Asia's Current Impacts, Future Risks, and Health Benefits of Mitigation Policy. We just have set up a kick-off meetings, and you can take a look at our website on the left side here. And one more that linked to the climate change and our environment is, this is also my research group, research network from SEPA. I use the word SEPA. SEPA stands for the Clean Environment and Planetary Health in Asia, with many researchers, I think about 8 countries, 38 institutes. We work together like this. Yesterday and today we have a conference, international conference and virtual. I think that's all for my presentation. Thank you very much, everyone.
Right. Thank you so much, Professor Kraichat. I actually have quite a few questions for you as well. Just, before we move on to the next speaker. One question is that you mentioned a lot about the microclimates, right? How different parts of the countries have different impacts or effects from the climate change. I wonder if you've started thinking, or have you done some research upon the combination between temperatures as well as humidity and ventilation? Because all three of them actually contributes to how the livable that space is. So that's one question, and the other question is in regards to the ENSO, or the El Nino Southern Oscillation. This is quite very specific to the Asia Pacific region as well as South America. you've mentioned a little bit about how you've compared data from 2009 and 2020. Yeah, and so I wonder if the choosing of those years, corresponds to, if it's the El Nino period versus the La Nina periods and so on. So that's sort of the questions that I have in my mind when listening to your talk.
Okay, thank you very much for your questions. For the first question, it's quite difficult because now we concerned, if we talk about the climate change, we concerned about the macro level, in national level, global level. But for the microclimate, like in our house, in our room, in hospitals, it's quite different because there are many factors that influence the microclimate. For example, if we install air conditioner, and from my experience, I have a chance to investigate some buildings. It's really nice places with comfortable temperatures, maybe about 20 degrees Celsius, not higher than 25 degrees Celsius. But my investigation, we found that the people who work in that microclimate, they have a problem with respiratory system. Yeah, this is one point. And the owner of that building just gave a call to me, I think maybe about 10 years ago. Okay, hi Ajahn, please come to my visit my building, because I observe many problems from my employees because they just take a rest and just declare the medical doctors the certificate that I have a problems, and the manager just said, I observe more than 90% that mentioned about respiratory disease. Please come. And when I visit that building, yes, that's correct, with cold temperature, but we found like the functions that in that buildings due to proper humidity. When we talk about the microclimate, we have to think about temperature, including humidities. Yeah, it should be comparable. We should be consider both together. Yeah, this is very important that you mentioned. And from the second question, I forgot it. Sorry.
Regarding the ENSO.
ENSO. Yes, that's correct, because I just compare only 2 years. Actually, I have to present in terms of time series, longer time. Right now, I mentioned from the current research, we try to downscale the climate models from the global level to be our regions in Thailand and also our neighboring countries. And we try to see next period, like next century, next 10 years, what will be happened. This is because we need to take a look for the time series. But for my presentation, I just show the different year to give more awareness about this, but to see the different, right? But actually, we have to present in time series to see, because some year I forgot to check about the 2009 and 2020 according to the ENSO El Nino effect or not. I forgot to address the issue. Sorry for that. Like in 2011, I think everyone know about Thailand, because we have been. It was the disaster of flood, a big flood in Thailand, right? Including Bangkok. More than 2 months, we cannot operate the Don Mueang airport due to the flood, like that. It might be. Yeah, I have to check this one also. Yeah, thank you very much. Yeah.
I see. Thank you. No, I didn't mean to critique your work or anything. It was just something that I was wondering, because I've worked in Peru before in a water lab. And so the ENSO was something that quite prevalent in the scientific, I guess, world there as well. So yeah, thank you so much, Professor Kraichat. Let's move on to our next speaker. So we have Mr. Pongsak Yingchoncharoen. He's the mayor of Yala City Municipality and the president of the National Municipal League of Thailand. His work has been very, very renowned, actually. I've visited Yala once and I really enjoyed the city itself, and I've got involved to talk a little bit about how you are moving the cities forward in a very progressive ways. So I'm excited to hear your talk. So please go ahead.
Good afternoon, everybody. My name is Pongsak. I'm the mayor of Yala City. I had been the mayor for Yala City, I think, for 18 years already. So I was assigned to present the topic in the Rethinking City in the Pandemic and Vulnerability Era. So I will divide my presentation into 4 parts. The first part, I would like to discuss to go the theory that help identify the problem and briefly explain how human, animal, and the environments are interdependent. The second, I would like to present to my Yala City solution to achieve the good governance on people health. Thus, I would like to share my perspective of the future city. And the last, I will emphasize the role of the National Municipality of Thailand. That's my post now. I think when we start to preparing for this talk, I would like to talk about the theory, the principle of the overpopulation written by the Thomas Robert Malthus. The theory states that food production will not be able to keep up with growth in human population, resulting in disease and famine, war, calamity. So the Malthusian crisis emphasized the importance of overpopulation and limited resources, which lead to overexploitation regardless of technology innovation. The question that's considered related to for this theory, and I was considering on the first, whether or not people have access to the high quality of resource to maintain their personal hygiene, instead of focusing on healthcare and disease, but and on the quantity of resource available. The second, consider his theory from the perspective of the agricultural and financial support structure to keep up with hunger, but correct in his warning about the inability of the global medical entity to provide adequate care for disease. It is clear that human, animal, and the environmental are not the only living being that matter, since all organisms are interconnected in some way in the same ecology of the earth. The relationship among human and animal health and their shared environment are not new. Increase in human population, industrialization, and geopolitical problems accelerate global change, causing significant damage to biodiversity, extensive deterioration of ecosystem, and considerable migratory movement of both mankind and species in general. These rapid environmental change are linked to the emergence and re-emergence of infectious and non-infectious disease. The underlying premise is that the health and well-being of the human population will be more and more difficult to maintain on a polluted planet, suffering from social or political instability and ever diminishing resources. The change in thought towards the One Health concept had been fueled by a number of high-profile international infectious disease events over the past several decades. Other human and animal health concerns have also contributed to the urgent call for new approach to the global health management. This includes antimicrobial resistance in human and animal pathogens, shortage of fresh potable water, pollution and environmental contaminants, food safety, food sufficiency, and insecurity. And the universal global condition of rapid environmental change, one of these factors, contribute to what many view as a crisis in global health management capacity, in a demand for new mechanisms to address health threats in a horizontal, integrated, and transdisciplinary way. Despite the evidence of the enormous social and economic costs associated with the deteriorating capacity to achieve health objectives in all countries, addressing the emergent and consequence of health threats through an integrated, horizontal, transdisciplinary approach remains challenging. In the Southeast Asia context, not only that our population make up more than 9% of the global human population, but we also face with several challenges, including biodiversity, growing demand for animal protein, deforestation, and last but not least, wildlife consumption and trade issues. Southeast Asia encompasses a range of lifestyle that rely in some way upon wildlife resources for food, medicine, coaching, and other products. Now that you are aware of the overview, may I begin with the good governance. So I have mentioned the three key challenges in Southeast Asia, and I have raised the question about the accessibility and availability of high quality resources, and the question about the adequate healthcare management system. At a city, how can we establish good governance on this topic? In the next section, may I share my experience in Yala City Initiative and how we incorporate technology and innovation to become resilient using Thailand's smart city concept. May I give you some background of my Yala City. Yala City is a small part of the Southeast Asia. It's a small part. It's around 10,101 kilometers from Paris, to be precise. And you can see on the map, it's not a big city. However, the COVID-19 pandemic was damaging to us no less than other cities. For the Yala City profile, the total area is a 19.4 square kilometer. We have 42 communities. The population register is around 60,000 people. The key unique point is that we live in a multicultural society composed of Buddhism, Islamic, and Christianity, and etc. The foundation is identifying local capital and then developing on top of the valuable city assets. Yala province is recognized for having the most beautiful city planning in Thailand. Moreover, the Yala City Municipality was selected as one of the country's most healthy city by the World Health Organization in 2000. It was also awarded as honorable mention in the UNESCO City for Peace Prize for 2002 to 2003. On the other hand, we have successfully run the land readjustment project to turn landlocked property into orderly, valuable land assets with the participation and engagement of the landowner. We have some initiative. We put up a lot of effort into data collection and policy formation based on the data collected. Here are some of the examples of Yala City Initiative to improve citizens' health and well-being. This is a green corridor and infrastructure project where we aim to increase green space and carbon dioxide absorption capacity. The goal are to have the most achievable stable temperature within the city and provide people with high quality air. Next is a smart mobility data management project. We using the big data to formulate lockdown policy during the COVID-19 situation. After the implementation, the data highlight a successful prevention of the spread of COVID-19 at a certain level. You can see the red point stain that represent my municipality area, and the stain now is my neighborhoods on the neighborhood, so we can calculate the movement of the citizen between the sub-district, and we lock down. We using this data to lock down. We assign the one measure we call the limit unnecessary travel. And so now we can solve the problem of the COVID-19. This is one of the Yala City initiative. We're focusing on smart governance. So we established an official online communication channel with the citizen through Yala mobile app that require registration before usage. The purpose is not only population data collection, but it also includes function as a campaign channel, public space reservation, social listening, registration of senior citizen, registration of disabled, and when you do the good thing, you can get a social coin from this mobile app as well. And furthermore, we have a project on technology system for management, the monitoring and control of COVID-19, where free Wi-Fi are located around the city. Like is commonly used by most citizens. Therefore, an official account serves as an unofficial communication and campaign channel between municipality and citizen. And during the epidemic, we supplement the vaccination information function. For example, like the reservation for the to be vaccine and to test for the to reservation for the COVID test, antigen test. We use Line as a channel for the communicate with our people. Yala Marketplace is another initiative. It's another successful project that was implemented as a solution to COVID-19 shock on the economy. The objectives are to help continue local business and minimize the increase in unemployment during the shock. It also complements social distancing measures, reducing the number of people eating at the restaurant. Yala Market's platform not only offer foods, fresh grocery, appliance, but also offer, but these are also very type of service ready for customer, even for the unemployment. And from, for example, the factory layoff, they can register for to this application to get the job. For animal, it's a part of the OneHealth, and pet owner will introduce a microchip implantation project to help decrease the risk of pet loss, reduce the number of stray animals. And for smart energy, the waste to energy plant project is under construction. It's occupied around 11 acres of land located on the outskirts of town. The plant itself uses the PowerMax twin-fire gasifier technology, and we have the dye and aerobic reactor to use the organic rubbish to add to get the NGV. This NGV will be used for the infectious plant reduction. This project will enable Yala City to achieve a sustainable waste management and clean energy in the future. Apart from smart city solution at the local government, we take action at the primary healthcare units. We have COVID-19 active case finding, tracking COVID-19 with wastewater. So we collect the wastewater and we analyze the residual from the SARS-CoV virus from the wastewater every 2 weeks. Providing community fitness, and we provide the community fitness center launching food security and traceability research with the UNDP and offering rabies prevention using the vaccination as well. As a part of the future city, I think we can see from this pandemic, I think the important keyword is the air spread, because the epidemic or pandemic will be spread by the air, by the social contact, by body. So we use this as to use this parameter to decide for the future city. On this slide, I would like to point out that public space in the heart of the city life is now being questioned after being the biggest target of the virus spreading prevention, like the lockdown and social distancing policy. The concept of healthy city is important. People have to think about long-term care, like the health benefits of clean space, air, cleanliness, and sustainable quality of life. Also, practically, is key. It's necessary to know the condition and effects of the city and public space planning. City planners should think about the general public and let the community be part of the design process and discuss the direction of our public space after COVID-19 together and create sustainable change. And this picture shows the future urban mobility concept. It must combine an economic sustainable and emission-free service with a reduction in capacity due to distance restriction, together with the appearance of new individual vehicle and flying machine. Also, new shared mobility service are offered. Clearly, urban mobility tend to consolidate a service model offered by more or less autonomous and shared electric vehicle. City re-evaluate their space to reduce areas for car and win social space for citizens. Indeed, rethinking the construction of new lane for individual electric vehicles such as bicycle or scooter fuels. Walkable city is another concept that will gain more consideration in the future. Now I will show you the new city side. The efficiency of public transport determines the real size of the city. Control rapid rise in economic opportunity make city appear attractive financially. Economic growth alone cannot guarantee they will be able to attract and keep ambitious mobile workers. This concept of metropolis enables cities to become hubs of international influence in the global competition for talent. There is something fundamentally urbanistic about this demographic. Young talent are vocal advocate for safer streets, extensive bike infrastructure, and effective public transit. The business boom allows transit is not just a city thing, but it's happening in the suburb too. Communities that are moving to the suburb are finding locations where their talent can commute via public transit. And you can see the pandemic has shown the extreme value that critical supplies, such as food or energy, bring to the community. The need for a resilient provisioning system has become clear. One of the key benefits of digitalizing agricultural food supply chain is being able to trace and track food products more easily, thus having more visibility of the food supply chain. Instead of food safety concern, food fraud and food sustainability, food traceability has become a prominent area of focus for many food industry players. Food and Health Authority, as well as solution provider, the competition on the retailing channel between online shop and e-commerce will be more tense. It's clear that in order to compete with online commerce, local shop not only need to take advantage of technology to offer their products online, but also take advantage of their proximity and the quality of local and fresh product as well. New work style is pointed to be hybrid, remote, and distributed, impacting the traditional working model with thousands of civil servants to a more decentralized concept. Definitely, the adoption of advanced hybrid team working technology and all integrated work and personalized digital tools are must for the future city. Security in the handling of sensitive data in public administration and privacy must be taken into account when setting up the new work environment. The real needs for the use of office and their capacity is reconsidered. Lastly, we can't ignore the security issue. More of our personalized and business activity are being conducted online than ever, making cybersecurity a key issue of our time. Nobody can tell exactly what the next major cyber threat will be or where it will come from, but experts still have a good idea of the general direction that we are heading in. Cities need to pay attention to information access, digital life management, security challenge, digital privacy and anonymity, and technology advancement. Fundamentally, our society is more technologically reliant than ever before, and there is no sign that this trend will slow. Data leak that could result in identity theft are now publicly posted on social accounts. A lack of focus on cybersecurity can be damaging in a range of ways, including economic costs, reputational costs, and regulatory costs. Now, on behalf of the President of the National Municipality of Thailand, we have come to my last point today, my presentation. I think the National Municipality of Thailand in this topic, the first is also worth mentioning that in the context of Thailand, we have the National Municipality cooperation among local authorities is necessary to achieve the goal in the bigger picture as a nation. Local governments in Thailand need to stand up for more decentralized power from the central government in order to improve urbanization efficiency in different cities around Thailand, instead of creating an overly populated density capital like Bangkok. Second, education sharing between cities is key to moving the nation forward. The sharing economy can contribute to social, environmental, and economic sustainability, and sharing city can unlock new opportunity and solve an urban challenge by facilitating and applying the sharing economy in urban context. But it is crucial that the sharing economy is shaped and designed to advance urban sustainability. The third, put forward the award-winning city to establish a cohesive and coherent goal among cities in Thailand. And may I conclude my presentation? I would like to quickly summarize that the main point of this are just the beginning point of our long-term goal of becoming a smart, resilient, sustainable, efficient city with effective governance. As a mayor and policy maker, a short-term solution is no longer a choice. We need to look at from the long-term aspect. The world changed faster than what we have anticipated, and Rome wasn't built in a day. Patience and perseverance is key. The COVID-19 epidemic is another warning sign that notifies us to pay cautious attention and consideration on the One Health concept. Smart city, on the other hand, is one of the solutions that city and government around the world can consider to adapt in the digital disruption age to strive forward, and that brings us to the end. So it's my presentation. Thank you much for your attention.
Right. Thank you so much, Mr. Pongsak, for your very, very, very inspiring presentation on what you've done for Yala itself. And it's also quite nice to sort of we started off with Professor Kraichat, who looked at the very macro level of climate change, and you've sort of scaled it down to our kind of city-based initiatives. I have a few questions for you as well. As we go on, you'll start to notice that I'm a very curious person. So you mentioned a little bit about the project on land readjustment in Yala. I wonder if that's something related to the Green Corridor development that you presented right after, or is it for something else? And if so, how has the people been kind of receptive to such change? Because land readjustments really it's quite a challenge in its own, right? People sometimes try to hold on to their land and not complying to the land readjustments models and things like that. The second question is in regard to the smart city development. Thailand have been trying to improve our cities into, you know, smart cities and so on. But the challenge that I feel that we've often kind of overlooked is the amount of energy that we'll be needing in order to run those smart cities. You know, be it, you know, I don't know, electric vehicles, be it, you know, all of the data acquisitions and everything, right? Or the database themselves. So I wonder how you kind of navigate that balance between, you know, developing into the more advanced technological driven society versus using more of the I guess natural resources for energy consumption. And then the last question that I have for you is regarding the food traceability, which is really interesting, right? You've tried to kind of make it possible that the local markets and the local farmers are able to produce and kind of sell things within their own space. But I wonder how much of it also contributes to the biodiversity of food within the areas, because we often see, especially at the moment where, you know, big corporates are putting their seeds out into, you know, and give it to the farmers. And so local seeds that have those biodiversities within it is getting lost in so many ways. So how much of that has been part of the conversation in looking into food and sort of the sustainability of it? Yeah, sorry if the questions are a bit challenging, but yeah, those are some of the questions that I had.
For the land reassessment project, Yala City, I think we start 15 years ago. I think the first project in Thailand. The principle of our success is we try to, to use the participatory management to bring the people to engage every step of the process. You know, we have done, I think, nearly 10 years, but the piece for the piece this land readjustment project, I think the biggest land readjustment project in Thailand, because the total area is around 350 lai. That means and 350 lai is, I think, is approximately about 150 acres, something like that. And the land owner is about 97 landowners. So not all the small landowner and 250 pieces of land. So we try to communicate and to educate the people how benefit they can get of the land this project completed. You know, when we start from this project, the land price over that area is around, I think that time 40,000 baht a lai. Now 8 million baht a lai. I think at 200%. But you know, I mean, and many people they share some percentage of land. For someone for the landlocked area, they have to share around 15% of the land. But for the people who have their lands next to the road, they don't need to share for the, but they're happy to share around 5% or something like that. So we have quite take a lot of time, but now we finished already. Now we move to another the second project, because Yala is recognized as the most well-planned city. So we try to use this philosophy, and also we have a lot of projects done to come to socialize the people to love their motherland and to keep for the other links city we consider as our asset, because Yala is not a big city. We don't have a big name politician, and we don't have the big investor. So all our asset is a non-monetary asset. We try to educate the people like this.
Okay, so you use the social assets as part of the city development.
Yes. And the second question, I think about this, how we balance. I think what our Yala city, we consider the environment is the very important. For example, after the COVID-19 pandemic, I think it's clear that the environment is very important. Why? Because now we can work anywhere in the world. So where the place we are selected to live, I think that's me. Because now we can work anywhere in the world. For example, like this, I am in Yala, you in Bangkok, and the other listener in France, or that means you can do anything anywhere in the world. But the place where you would like to live or to select to live, I think very important. If we can make our city, especially to put on the focus on the environment, to keep the city cool and comfort and safety, I think that's is a heaven for the people, paradise of the people on earth. So I try to reclaim the water reservoir, because water to make the city is cool, and then I try to plant every year 10,000 trees a year, because my ambition, I want to reduce the urban heat to sensitized. This is my ambition. For example, when we set up the budget, many schools or teachers, many officers ask me to buy the air condition. I have to ask them to plant the tree to exchange.
Oh wow, that's really clever. Yeah.
And also, for the waste now, for the plastic and like the full of it, like the plastic or foam or something, we do for the RDF, use the gasifier to generate the power. But for the organic waste, I think we use the Chiang Mai University technique. We use the fermentation to produce the NGV. The residue of this waste, I try to research. We can use the worm to digest them. So that means a zero waste. So if we can claim that our city is green and clean as well. And now, what's my object, my aim, my dream? Want to go? I want to set one of the roads, one street, to be the car free. I mean, to not a car free. It's an EV car street. Just only EV can go inside. Because what the advantage of the Yala city, we have the bike lane, so we can use this bike lane to be for the e-scooter, to provide for the teenager to use to the school, and we have quite unique for the routes in Yala, because we are good well planned city like I mentioned before. So now I start up to do this project now, and I think the third about the technology and data. I think the data is very important for the decision and planning. So I try to collect every data from the city. I think the city should be own the data. Why I have for example, like the application, I ask the people to register, because this application you can use for reservation for the public service, and also reservation for the everything belonging to the municipality. You can use the application. So everyone have the digital card. So this digital card, can next time I try to add on the top up money for this card as well, because we have the market space. I show you the Yala market space, so you can up the money to this card and to spend the money to buy the thing from the merchandise in the city, and we can collect for all the data and our Wi-Fi as well. When you come to Yala, it's a welcome to Yala city to connect the Wi-Fi. Like every big city in Europe or something like that, every city when we go into the city, you connect and they can something like that. They can get the data what we have done when we stay there. So I try to collect on this and try to something like that to right now all the communication duct under the cloud is belonging to our city as well. So I have a bargaining power to negotiate with all the big operator in Thailand.
Okay, I see. Thank you so much. Yeah, I totally buy into your data-driven governance is very important. We do have a question from the audience. Would you like to ask it yourself? I think it's from can't see the whole name. Claire something.
I think
DJ Clarero. Yeah, sorry.
Okay. No, yeah. Yeah, Clarero. Would you like to ask the question yourselves, or should I?
The question.
Okay. Sorry. Little here.
Yeah, we can hear you well.
Okay. Personally, I am attracted by Mr. Pongsak presentations, especially for slide of food traceability information system. In some case, inappropriate chain of player is in charge to supply chain management and create disruption. So my question is, would you mind about inappropriate chain or player that create the disruption? And what is your approach to deal with them and ensure the equity and continuous supply chain management in your administrative region?
Now, may I answer this question? Now I just start to do this project with the UNDP. UNDP select Yala city as something like a pilot city to do the traceability. So what we have done now, we study about the composition of the food in the Yala market first. Like for example, the vegetable is where it come from the other province or from the other district, something like that. Fresh meat from where, something like that. So now we collect on the data, and then after that, I think we get some opportunity to see to persuade the people in the city to produce instead of to import from the other province. That means we can secure in terms of food security next time. And after that, we have our market space. For example, like I showed your Yala market space. We offer not the food, the finished food, but we also provide for the fresh food as well. So we try to bring all the merchandise come into this our market space because we have some incentive. For example, the trader don't have to pay for the commission fee because I want to increase their disposable income. That sometimes that means I can prevent some, inappropriate chain, something like that. But during on the process, I think I have to educate the people and to educate the people and also especially for the buyer and to buyer to select the food from ours, like maybe we have to some like the guarantee some foods for this producer and to prevent for this inappropriate chain.
Okay, I see. All right. Does anyone else have any questions for Mr. Pongsak? Because he has other obligations he have to go through. Anyone has any further questions for him? All right. If not, then thank you so much for your presentation. After listening to you, I feel like I should then move to Yala and work from there instead. It sounds like a wonderful city. Yeah, I've actually been there once, and I really enjoyed the city. It's a really nice city indeed, and you actually have a lot of natural resources around the cities as well. I think you're surrounded by a lot of forest and the sort of tropical mangroves and everything. So yeah, thank you so much for your presentation and your time with us. If anything, we'll keep in touch, and then hopefully, you know, with the National Municipal League of Thailand, I have heard about it as well, and hopefully, you know, the release of centralization and the contribution to decentralization can happen soon. That's my hope for Thailand.
No, don't move to Yala. Move him to be a Bangkok governor.
Let's move out of Bangkok. So yeah, that's a good segue, because Yala is a very small city, right? You only have about 60,000 people. Now we're moving to Bangkok, our 10 million people city. So the scale is very, very different, and the challenge is also very, very different. So let's welcome Ajahn.Tavida Kamolvej. She's the Dean of the Faculty of Political Science at Thammasat University. Many of you who have been here yesterday probably are very, you know her already, but I just feel the need to reintroduce you. And your talk is on making collaborative health governance work better in the mega city of Bangkok. Very challenging indeed. Please go ahead.
Thank you very much, Ka. And envy Yala a lot listening to all of that. And I know you for like lifetime, and you still impress me every time I see you. Thank you very much for switching me from yesterday as a moderator to a speaker of today. I will try to make it as less time and as fun as I can. So I intend to make my presentation in 2-3 separate kind of issues here. First, I would introduce you to not to the whole Bangkok yet, but to the idea of how I see the city change.
Excuse me. Sorry, do you mind making it the whole presentation?
Okay. I intend to actually address it as how I see the change at the cities and what have we learned from COVID-19, especially because I try to cover myself in health governance rather than a resilience one, as of I'm still into yesterday topics. And the second one, I would move you guys to see how's the change that I want to make them make the collaborative health governance work better, and specifically into a mega city much like Bangkok, that we can see all the beautiful thing and all the possible plans ever. And then I still think that there are a lot of impossibilities that need to be made possible. So let's see, that would be all that I covered today. To me, I think city, when city have changed, that it changed by itself too over time. The city itself changed. So the city as a subject of the change, it changed because of the degradation, because of the development, because of the exploitation that we actually make the city change. The other way around, I think city people do change as well, because they have to actually have a lot of correlation towards city that perhaps change with planned or unplanned or unexpected change. And also we have city policies that actually try to change city too. These three supposedly to be in one direction, and with the direction that they care one another and empathize enough. However, to me, what my feeling is, I think the speed among these three separate change are not quite in the same way. I think what speedy the most in the past, before this whole disruption, the change that had at the speed the most is city people change. Their life is so quick. They don't care about anything anymore, just try to get back home to sleep, come up on the other day, work to death and then weekend is pretty much being actually dead on bedroom. So that's what the speedy change in the life, and they care less than they should be. And that would be one of the factors that we have to change it. Otherwise, you cannot make the health governance work better. I still think that as much as we want to blame the city government, we also have to come back and look at our culture, whether or not we do have a culture of making the health governance collaboratively as well. From the disruption, it forced the city to change rapidly as well. So these two, in this moment at time, change very quickly. However, the city policies, the city administration, and the city direction was so slow, like a slot to me. And because of this, the speed, it's just like cannot keep up with one another. That create a lot of fuzzy logic that happen. So, and by this, the development go one side. Crisis, disruption, change, degradation, pulling it the other way around with a different speed. And if with this, we are going to be overwhelmed with the change and crisis that happened. And this is what I see from last time of the COVID-19. Since Professor Kraichat and Mayor actually mentioning about the relationship between central, provincial, and local, let me get to the relationship of health governance. The whole country, I'm going to be quick on this one and then narrow it down to mega city, much like Bangkok. I think for Thailand, that is not just a complaint. It's also a best lesson learned as something that to be like in love with. It doesn't mean that we only learn from what is actually bad. Of course, law, regulations, outdated, not appropriate to the situation. People who want to use these regulations, especially in each of the city, you are not going to find a mayor much like our beloved from Nayoka. No, you're not going to find many of them like this. So to be, with all due respect, if we have like million of him, that would be nice. But then we can. Then we have to make sure that the leadership, according to how to authorize the power, is also come with the power of knowledge and the power of data, not only the power of authorization. And with that, that create really a bad single command system, which is not the real thing. Single command system doesn't mean single commander. It means the command, a single direction of command pass through, relying on local government to be able to make decisions as of their own. However, still within the direction that we all agree upon. So I think this needs to be changed too. And that means the real meaning of decentralization, of course. We have inefficient public communication and coordination information system. The mayor already said, I'm not going to actually dig deep into this. We have a distrust relationship. Yesterday, actually, from yesterday, Dr. Nitya from health sector, she mentioned a lot, even though she come from medical kind of area. She also mentioned that the trust toward the government, the trust toward the leader, it doesn't matter what level of the leaders, you need them. Otherwise, if you're going to move health governance, this is a very technical term kind of way, half of it. So you need that. We kind of not having it. And we don't have much enough of those what I call safety nets. And that have to be created upon a segmented and empathical, I'm actually creating my own word, of the data system and create that local by local. You cannot make the same, the whole country has the same system. The core of it, 70%, I agree. Another 30% supposed to be flexible and agile enough. We learned something good too. We have excellent hospitalities partnership from NGO and from the network of the people and from a lot of private sector, that's for sure. And we will bring that back in my recommendation that I think how to move the city toward that. We have amazing healthcare standardization, even though the healthcare in the city, especially Bangkok, it's still a little poor comparing to the standardized of the national healthcare system. We have a lot of adaptive capacity of local self-sustained measurement and leaders. One of the example already finished his presentation, so I'm not gonna go down to that. I think the relationship between the central provincial government, local government, or central, national, federal, state, or municipalities, it has to be changed too. Otherwise, if we only change only at the city, that is impossible, especially in developing country that decentralization is not real yet. When it's not at their full power, It means that you're still relying on interaction and interdependency between them. So I think some of that has to be altered here too. I think the central government has to switch their role to be enabler rather than regulator only. If you are going to be a regulator, please be regulative enabler, which means that unlock everything that is locked. Believe it or not, like Bangkok itself, they have a Bangkok Act, the grand big law that actually make them administer Bangkok, the whole Bangkok like mega city. And the Bangkok law is actually, how many years old of the Bangkok law? It's 35 years old, I guess. That's how old that is. Yeah, it's only 5 years younger than me. So it's really old. You're not going to be able to use what? The law that actually be drafted 45 years ago to actually 35 years ago, I'm sorry, to actually manage the city. That's not possible. The central government needs to really learn how to make single command through multi-agency coordinations if you're going to make the governance work. And that will actually direct to provincial as a mentor and collaborator. Big data system that we call upon. I do agree with the mayor that the data system has to also be collected segmentedly and per area basis from the local area. But I think the local authorities and local administration has too many unnecessary jobs to do at the moment. And if we talk about integrative area development, because health governance is like, see, epidemic, outbreak, pandemic, you don't have the real jurisdiction here. You have it cross-boundary. So I think who's best to actually help developing integrative data systems segmentedly and also working as a mentoring of the implementation system. I put it at provincial level and then make the local level the decision makers and the doers. And I'm gonna pick only making the local decision makers and the doer because that's the only time that I have. If you have me go all over this, it's another 3 hours. To the city, rehabilitation and redesign from what is actually happened. I think we need to do both renew, we need to reconstruct, and we need to actually renovate. These 3 words are actually embedded because when you said reconstruct, it means that you have to really want to reconstruct. And we're talking not only a physical construction, we are talking about a construction of power structure within the city as well. Not only the city with provincial and the central government. When we said renew, sometimes, a lot of plan the city has in the first place is not that bad. However, it perhaps is a little old, it's a little like outdated, it needs a revision. Some of that just need a new kind of idea adding on. And you need to renew what is already there. You can't keep like building new thing and then going make a project. No, you might actually want to go back and look at some little things and trying to make that little thing actually be able to survive in a present world. Last but not the least, anything that you actually need to renovate, you have to do it. Because remember the word trust? The word renovate might be a little superficial to everyone, but to me, sometimes trust is dependent upon communication too. If the work is done reconstructively and renewably, then you can actually renovate those kind of image of the city and make people fall in love with that city again. That is not actually difficult to do. In order to do that, I think the next kind of hope that I have between all the 3 and then also the hope for the city is that I need real decentralization, but in order to go there, I know it's not going to magically happen tomorrow. We need capacity building to the local government. And we need to take what is the momentum the most. Yesterday, Dr. Moran is actually mentioning about trying to grasp the momentum. I myself personally, this is only my words, not his. I think that momentum is actually passed quickly for Bangkok though, for Thailand as well. I don't know if that momentum is still here to make people want to do radical change or dramatic change. So given that, I do agree with him. We need to grasp this momentum of health governance. Making a collaborative health governance is actually happen. So not only the redesign of the relationship between all levels of the government, we need to make sure that the locals is actually know that the power that they have to register by the power of data, the power of understanding, the power of knowledge, and then the power of authorities. And with these four, we can then move to the construction of the new city. I think into making health governance, I like the word streamlining. At first, I don't know how to translate it in Thai, to be honest. I don't at first. I tried to bring up like a very beautiful words, like a lot of vocabulary organizations trying to do it. I can't. So, but right now I can. So basically you just insert it into a daily life. That would be my translation into this. So to make it work, at first, city, just rest them there first. Streamlining health into the development. This is the first step that I think we have to grab the moment. I actually won a mock yesterday. I actually kind of like have the punchline from the speakers yesterday, and I'm going to link it into mine. Yes, and I also believe streamlining health into the development, it's empathizing diversity with timely decision. I believe in this myself. And then yesterday, Dr. Wiwi is actually mentioning about making resilience from the bottom. So basically moving resiliency, not a very difficult one, make it an easy one, and then make it to people so that they understand that their little life, their little way of life of every day is actually can be translated easily into resiliency. So I think that's also sparkling to me. And Janiraman also, she has her famous quote like this: making everyone visible and be heard. So basically make a noise, a voice. So in order to do that, it means that we have to be able to know, and with that, it already an evidence that you cannot make the whole city, even if the city, you cannot make it like, you cannot make everyone wear the same shirts anyway. So you have to do open government. You have to be able to exchange data and learn about what the needs and diversities are. So we have to be able to translate what exactly called healthy, what exactly is a health safety into those diverse needs of the people. Also, I used to believe in decentralization and simplifying this decentralization. And yesterday I got it from Dr. Nitya that not only that, medical itself, you need to simplify health matters as well. And by doing this, I think it's simplifying what exactly is the technical term of this health thing into local understanding, so that volunteers of the local can actually be one of medical care person. And with that, we can have like manpower support, and that was actually going there. And empathically design into norms and livelihood. Because, you know, sometimes, especially this outbreak, COVID-19, to be honest, in January, last year, 2020, in January, when we heard about COVID-19 in the first place, come on, who cares? It's in China. Even though we have Chinese tourists a lot, who cares? It's far away from us. See, wearing masks, what? We didn't even actually have that kind of culture, which has turned out to be good because we've been forced to wear that mask easily. So basically, that's what not in our livelihood and norms before. So just translate it in and do the translation into city strategies. I know Professor Wan has one question toward environment and health. I'm gonna hold to the answer rather than explaining here. But I think what Dr. Moran talked yesterday is also emphasizing important that sometimes you don't have to choose between economic, disaster risk, flood, drought, economy, and locking down the city. So the idea, the fabulous idea of if we have a really smart design, we can actually balance it out. But that balance it out, you need multidisciplinary to actually give the answer on that. And you need open data, because if choosing wisely is easy, we will be doing that for a long time. We're not going to be in this damage. So you need to be open for kind of like discussion and opponents, so that we can get all the rest in the future that we foresight can be possible. Now, I'm going to actually take you to Bangkok right now from what I analyzed that I think the city should do so that it make it work better. Let's see what's going to be in the next 5 to 20 years that Bangkok has planned. Bangkok, after COVID, already have that planned out, and I'm not claiming that this one is good. I think it's just better. I'm part of doing that too, so I can't complain about that much. So from my research with my team, we arrive at, right now, Bangkok has these 7 strategies for the future, Look at your left-hand side. They try to create crisis resilience and safer society, environmental sustainability and climate mitigation kind of city, integrative public service and well-connected mobility. If you take this left-hand side kind of strategy, you can see that it's not bad. Am I right? This is kind of like a jargon, if taking it from what Ajahn always said. It's a jargon. Every city that wants to be a very beautiful one is actually claiming to do this. And it's a very kind of hard structure, very technical kind of strategy. Looking at your right-hand side, enhancement of equity and quality of life, making the city for all, engaging a city of every participation, and then promoting a value creation for economy. So it's a very soft touch kind of strategy on your right-hand side, which means the strategy care enough. And then all of that linked by just trying to be a professional kind of city managers to actually run this all together. So if I put it here and take in what Dr. Moran said yesterday, that we don't need to choose, right? We actually make the use of all that we have. It seems that it's there, but the problem is, can the city do all this? In how many years? How we prioritize this? How we plan what comes first and what comes next? As I said, health governance. I'm sorry, I had a question come up. As I said, health governance is actually a momentum. If I were Bangkok, I would actually take the left-hand side to give a priority of budget allocation. However, look at your right-hand side. We still have problem of small people that had effect from outbreak, pandemic, and it might be a flood coming up soon. And right now we have PM 2.5. And we haven't actually discussed about whether or not 2 layers of masks, the cloth one, can actually protect the vulnerable group. We haven't talked on that one yet. And we need to recover from economy. So basically, even if I want that momentum, it's less likely that we can wait. So this is really a challenging kind of question that I might not have the righteous answer. I only be able to have the prioritized answer to you. By all means, I want you to really take a quick look on professionality enhancement in terms of making the city work. And we will get into that as the most part, because all the 6, number 1 to number 6 strategies of Bangkok is well said, well written. And yesterday, all the speakers has pointed out every single thing. I have not had to actually mention anything anymore. But what is actually perhaps lack of yesterday a little, which is left to me anyway, because I'm having this topic, is how to make it work better. So I'm going to emphasize on the middle one, which is link every strategy to actually go together. Let's take a quick look, perhaps 1 minute each of the slide for 7 strategies. In city resilience, if you take a look at one point, I'm sorry, my screen, it actually shadow myself. If you really take a look at 1.5, healthy city, see, it's already there. Bangkok has a lot of health center, but the health center is not at the standard that they want yet. The city has really packed a general control yesterday of how the camp located and how of the slum and the community that actually very packed is actually construct very not hygienic, the hygiene is not very good, and is not very well taken care of as well, because we never emphasize on this primary care. We're actually looking at secondary care at hospital, and we never actually put the emphasis on the potential of it. So as the plan look nice, they have it as a domain of this grand strategy of Bangkok to make a city safe, to make a city resilient. One of the healthy cities is already in there, and it's put together with the safety kind of idea, a core idea. They have environmental sustainability and climate mitigation, which already taking care of preemptive health care, which means you have a clean air, basically. You have a good environment, you have a green city, right? You have a really like clean, no trash. You haven't taken care of coastal erosion in some of the Bangkok closer to the sea. And you actually look at those dust and everything. So basically this is preemptive. So you already have preemptive and proactive care in both of the strategy. Seem to be nice. They're looking at the equity and quality of life, trying to make universal design, trying to care for everyone, trying to get those labor and those population. Bangkok has 6.4 registered population. That's in the legislation. But on the daily basis, Bangkok has about 10 million people. So you're talking about 3-point-something millions coming in. So basically, how are we going to make Bangkok service those coming in with health risk and might actually coming in with environmental degradation? So it is not an easy way. So to be able to actually take care of that, making the connectivity very well done, and integrative public service, making sure that all the infrastructure, especially logistics, is actually well connected. This is what the dream of Ajahn Niramon the most, I guess. However, it's not easy because you were talking about a really poor urban planning. I'm really sorry, Ajahn Niramon would hate me for that. The urban planning of Bangkok, it's really not very good, very unplanned. And whatever plan to change is really too slow to the disruption that happened. So even if they have this kind of strategy embedded, I'm still thinking that how they translate it all together. Picture it. If you want all the BTS connected, oh, very well done. Connected with all the public transportation and blah, blah, blah. And then during those time of the infrastructure construction, how is it possible that you're gonna have zero pollutions and zero dust? How is it possible? However, Bangkok has a strategy of zero kind of like a healthy city and less accident and also zero dust and zero pollution. So the strategy itself pulling one another. If you don't have a very well designed integrative implementation plan and what to do in the time that you have to compensate, you might not be able to choose. But in order to make it parallel with the health governance thing, with the healthy city thing, you need to compensate. I'm serious, because if you don't want to choose, you have to balance it out and then try to actually taking care of the vulnerabilities of the city. By all means, yesterday we picked up that we have to actually hear those voices. They have a very good plan in terms of hearing them. Have not gone any far yet. And I'm not sure this is going to go. They realize the importance of it, but whether or not this engagement would be happen, I can't answer that. It depends upon whether or not the city push through. Believe it or not, we have 50 districts. Bangkok has 50 districts. By law, Decentralization Act, each of the district doesn't have to have the same policies. They don't have to have the same public service. They can design their service interdependently. But then the district, head of the district deputy, has he have his gut enough to actually do something differently? It depends upon whether or not you get the mayor of Yala coming back to my presentation. So that's why I said you need a mechanisms that can make sure that the accountability is there so as the liability for those people who want to create things that suit with their people, responsible for their people, accountable for their area. However, it's different. Something new can happen. Everyone wants security in their career. We can't blame them if they're going to go follow everyone and buy the rules, right? We need initiative, we need innovation. Then we need a gut, but that gut has to come with accountability and liability. This is an economic thing. They push through the creative already, but I think to myself, to be honest, I think this strategy would be slowed down. I think at this point, Bangkok might have to think about recovering from the crisis first. And that might not be able to emphasize too much into value creation. It might go just like together because we have too diverse of the people who have a career, job, and lower market in Bangkok, too many. I think this one is going to be a slowdown one in terms of making Bangkok the center of business activity is not difficult. We turn out to be that way anyway after the crisis, if we have and after COVID. But to make sure that everyone was taken care of and not be taking advantages on, that's going to be a huge job for the actually next governor. These are what I want to emphasize the most, and I have about 2-3 slides left. I think law of regulation needs to be renewed. And you need to have monitoring and evaluation. Thai government, the whole bureaucratic system doesn't have a very serious and lesson learned kind of evaluation. There are different in public administration. There are different between traditional evaluation and the new way of evaluation. To make it short, old evaluation, you get a report. New evaluation, you get lesson learned. That's it. That's how much different that is. And because of that, then if the evaluation, monitoring and evaluation can be circling multiple loops, then agility, flexibility, accountability, liability, and quickly respond to disruptions, that's where it's possible. Reconstruct those human resources within responsive participative finance and budget system, which is really the most important of making collaborative work, and utilize the data system. Then to change the impossibility, I offer law and regulations that is too old and outdated. We need to change a lot. We need to actually emphasize on the power and authority, but quote unquote, put the burden to them, making them a decision maker and doers, but capacity and potential need to actually be allocated too. Otherwise, you actually push the burden, you are not decentralized the mission. There are two different words. Strategic policies undermined by administrative decision. I don't think that many megacities, especially in developing countries, know a difference between strategic decision and administrative decision. Alongside with every country, almost, I think from what I heard yesterday, even Indonesia actually running on the 5-year strategic plan. So if you want the strategic plan to work, you need a strategic structure. You can't make strategy run on functional structure. Why? Strategy based on agenda and area. Strategy never based on function. And then you have functional structure to implement strategy. It's going to hell kind of thing, sure. Lack of monitoring and evaluation, been there and that. And then the city drowning on the city data, city management data, and city foresight data. It's like over there and over there and over there and over there. But nothing is linked, nothing is overlaid, nothing is integrated. So when you make decision, you are not making decision on one data set. No, it's impossible. You are not actually making decision whether or not you're going to buy dinner or not. That perhaps easier. So that's no. So the mega city, especially Bangkok, drowning underneath that. Real meaning of shared resource system. Shared resource system integration, yeah, it's a discourse to me. It's a jargon. It's a motto. To be able to make resource shared, you need a design mechanism. I will give that to you in a bit. Holding city managers accountable for performance. City managers in developing country mostly assigned, not elected. So to make accountability work, we need a monitoring and evaluation of the performance and make that as an open data that the people can access and see that performance. Who knows, in the next 5 years, we might be able to get 10%, 20% of their promotion evaluated by us as a proportionate kind of score to the performance of promoting people. And we need money allocation. This is my last slide to emphasize on, we've been talking a lot, especially I accept I am a disaster risk resilience kind of maniac. So I'm kind of like in love with a disaster. And I thought the people would actually feel the same way, which is not. And even us yesterday, to be honest, we are the same people, we care. A lot of people doesn't care the same thing as what we care. So in order to make the whole city move in the direction that we care, we have to understand that resiliency, health, disaster risk, environment, climate change sometimes cannot make priority on the table comparing to poverty, salary, right? Political conflict, revolution kind of thing. So in order to win that, you need some mechanism to make sure it doesn't depend upon leaders too much. It doesn't depend upon whether or not that person willing to do it too much. And with this kind of mechanism, it gives the leverage and liability to people who make decision, the true decision to respond to the community at large. And with this mechanism, somehow it made community have the mechanism to share and to be part of the city management. So I think the budget itself, the integrative budget that has been launched in Thailand actually, and a lot of province, even the mayor of Yala actually have to actually do this integrative kind of budget. This budget intended to do the area-based and agenda-based, which is to go budget of the city. So if we have health integrative, collaborative things here, then you need to make sure that cause and effect and impact is mapping to the budget used, share KPI, joint operation, translation of the result to the individual who actually work. And you have to have the data share in terms of controlling that. And that can help you prioritize which strategy to come first and then go second. To end this is kind of like too academic kind of saying. Let me use example to end my session. I used to work with Bangkok in one particular issue, obesity, or practically fat per people. Okay, I'm not actually bullying anyone, okay? I used to work with them. And then on one day, I have the data in my hands and I said, okay, right now from the survey, Bangkok has about 53% of people who actually overweight, okay? And I asked, what is our goal in the next 5 years? We want it to go down to 45. Okay, good, 45, 47 by then. And then I said, okay, let's see. How are we doing this? 5% less in the next 5 years, 1% each year, it makes sense. And I said, okay, who's actually getting fat? And then one of the department asked me, John, we are the doctors. Okay, what say you doctors? We are taking care only people who already fat. Okay. And then the other department, the Department of Public Health, raised their hand and said, John, we only take care of people who really going to be fat. Okay, now that's already fat. This one is going to be fat. And then I said, okay, who's taking care of the children that have the kind of like abnormally growing up kind of scale inappropriately? The bureau that actually taking care of education said, we taking care of that children, but when there is a but, I always have headache. But we only have junior high kind of kid. We don't have like in the university. And I said, what's the problem then? Oh, Ajahn, the BMI formulation only actually do on 18 years old people. I almost gonna end up dead by then. I said, hey, you actually measure their weight and height. You can't do the appropriate proportion of people who grow up appropriately. And that you can prevent the preventive kind of measure so that people growing up, and then you can actually make the healthy meal, healthy activities, sport, and then balance it out with the vendors that sell a lot of bad things on by. So you can see the fragmentation. Fatty, about to get fat, already fat, about to get fat, growing up fat. So you actually have to make them work together. And you need 5% less. They come to me and said, Ajahn, how are we shopping up the budget? I said, what do you mean shopping up the budget? We have 5% and we have 3 departments to take care directly to this. Actually 4, there as a department of sport as well. 4, can we do like 25%, 25%, 25% and 25% kind of budget? I said, okay, doing the math, the budget allocation as an elementary school, yeah, 100% divided by 4, yeah, you get 25%, 1/4 of the budget, that's fine. But if we're going to do this as a senior high kind of kid, let's do this. How many people are already fat? How many people are about to get fat? How many people growing up inappropriately? How many people that need a sport kind of project campaign enhancement? Can you get me the percentage of that so that we know how much to allocate the budget according to per head that we want to impact to the goal of 5% less each year, 1% less each year. And if you want the answer to be like university kind of answer, in that percent of the people who already fat, how many per head of the cost that we use to cure them after them getting fat? Is it more or less than people who are about to get fat and then we pull them back? With that kind of proportion, then you get a very real kind of cause and effect. And that can go to the impact of the KPI that control the budget and also the performance. And with that, that's how the goal of health governance collaboratively can get done. So, and that need a lot of collaborative effort and the really strong intention kind of city unit to keep monitoring and evaluation and use the real evaluation as a lesson learned, as a multiple loop if they can do it. And then the projects or the activities that can get done can be dynamic and then agile enough, but will respond to the disruptions or any less foresight kind of risk and problem they're gonna have in the future. Thank you.
Oh, wow. Thank you so much, Tavida. That's quite a lot of very interesting concepts and interesting your takes on the governance. I'm particularly interested in the word health governance that you mentioned. It sounds in some ways integrated into the sort of local government that we have in some ways, but on the other, it seems like you meant that health governance is also really focused upon the health sector itself. Could you clarify this a little bit more?
Okay. Especially in Thailand, I have to talk system by system, okay? Because otherwise, the word governance has to depend upon the system as well, okay?
Right.
In Thailand, you have Thailand first. In Thailand, you have the Ministry of Public Health, and then you have the representative of Ministry of Public Health in every province. In every province, except in Bangkok, though, by the way. So basically, it go that way. That's why, if you remember, during COVID-19, Bangkok governor and the Ministry of Public Health is actually yelling at one another in terms of the COVID hasn't come on the day that they actually schedule for people to have an injection. So basically, that's one way. And Bangkok itself also have their own medical department and even the hospital as well. But everyone is also controlled by the hospital accreditation. So that in their line of work, in terms of health governance, that is what I call ethical code, which is code of conduct. So by that kind of code of conduct, it ties them together. And also the budget that allocate from the central government to Bangkok. is also tied up in terms of what Bangkok want to do too. Bangkok has the money that actually from its own kind of tax, as well as the money that support from the government. Regardless that in the area that Bangkok has very wide area, but then the jurisdiction of Bangkok on each area is not the same. You still have a hospital that's not run by Bangkok in Bangkok. And you have private hospital, university hospital, Bangkok kind of run hospital, and you have Ministry of Public Health kind of hospital. And the health center in Bangkok is running under the Medical Bureau of Bangkok itself. So that's why when I know I'm supposed to talk health governance within local kind of city, but then I can't, because when we touch that, it's going to relationship between a hospital under a hospital care and the regulation of Ministry of Public Health too. But also the Bangkok itself had its own act that has its own way of implementation that they can actually make decision on their own too. So that's why there are two levels in the same time.
I see. So if I were to repeat that a little bit, there seems to be two bubbles, right? There's the governance of the city itself, and there's also the governance of the public health sector. There are some overlaps, which is where you talk about how there's this relationship between the public health or hospitals within the city that relates to the ethical board of the whole, public administration of the country. And so when you talk about health governance, it seems like it includes both of those sectors together. In order for the people to really have a better health.
Let me do the real situation so that it's easier, much like I do fat people. A vaccine. At the time, everyone perhaps some of the international audience might not know that there was one day that Bangkok have people register and schedule for COVID for an injection of the COVID vaccine. And then suddenly, Bangkok cannot give that vaccine to the people on about a couple of days. And as it turned out, this is what we heard. Bangkok said, Ministry of Public Health have not given them a vaccine. Ministry of Public Health said, we said the vaccine would actually come on in June. And then without communicating with one another that what it means by the vaccine coming in June. What it means by the Ministry of Public Health, it's coming in June, but in a certain amount, and it might be a pause in between, and it might not be distributed daily. They didn't communicate that. Bangkok does schedule people to come every day. So when the vaccine cannot meet the logistic, because transporting vaccines is not easy. You might have a contamination, you might have a temperature control, you might not have enough in the proportion that it comes. And when you draw it out, it cannot go back. So it's multiple ways. But then Bangkok rely on that gap to say that the reason that they cannot manage the schedule because public health doesn't actually give them vaccine. And Ministry of Public, we said we're going to give them, and this is not the end of June yet. We said in June. So basically, these are what I said. When you talk health governance, that is a relationship. To me, I'm mentioning this for several times. I said, and especially we need to know how it managed the accountability of managing it. Then I make a request. I said, since the vaccine can come only through Ministry of Public Health, serial numbers, how many, the amount that accepted, register. When you allocate these vaccines to Bangkok or any province at all, you have the number. And the number of every allocation plus together, it has to go to the same amount that it comes. Fine. When you give to provincial governor, I said, why don't public health actually do the mapping of the number? They said, we can. Ministry of Public Health said, when we allocate to the province, it's up to the provincial governor to distribute these vaccines to the people. They can keep monitoring and checking the number. I said, you can answer me this. Yes, during the day, you cannot keep up with the number because when the governor draw the vaccine out to their stations, some of the people make appointment but don't come. The vaccines already draw out. You need to allow walk-in, otherwise the vaccine will be in vain. So in the day, during the day, you need to let them have an authority to make decision of their work. But at the end of the day, it has to be the end of the number that the vaccine is used. Why don't we see the number at the end of the day at the Ministry of Public Health? Why can't you get that number for us? Why? And the registration for vaccine appointment. Ajahn Wan, you know, you can get the appointment confirmed from หมอพร้อม ไทยชนะไม่ได้ Bangkok ร่วมใจ AIS DTAC. You can get 4 appointments and you only have 13 digits. One set of 13 digits at your national ID, but you can get 4 appointments. What say you already of the collaboration?
I see.
That's the clearer picture, I guess. Sorry.
I see. Yeah. No. Thank you so much for the clarification. I think it's super important because sometimes when we talk about governance, it sort of, you know, paints a very broad picture of, and it becomes very abstract sometimes. And so thank you so much for the clarification. So I guess with about 30 minutes left of our time together, we can open the floor for other speakers to join us.
Yes.
If anyone have any questions at all?
Ajahn Wan,
Yes.
I have a question to Thammasat.
Oh, yes, please go ahead.
That's very interesting. No. Because as you mentioned about the vaccine distribution in our country, and this month I heard about the announcement of the transfer the sub-district hospital to under the control of the provincial management. I'm not sure because from your presentation that's very interesting. I found many limitations of factors if we transfer hospitals to provincial reserve, but and not all provinces, only some provinces, right?
Yes,
only 44 provinces. And I also what are the criteria that they select only 44 provinces and about the remaining provinces? Yeah. How about your ideas? What do you think about the future situations? Yeah. Thank you very much.
Thank you. This is actually a really, really good question. I actually did ask this question to Dr. Nitya yesterday though. Here's let me do the step. Actually, the healthcare is on 2 sides. It's the health hygienic kind of care, the preemptive kind of care, and then the medical care at time that something happened. I think the care has 2 things. So when you call about the local kind of health center that used to be at the local level before, and they want to really delegate and then move them, decentralize them to be under the provincial administration, because this is the idea of decentralization too, and also to be able to make them develop. Because the provincial level has a lot of resource over there. So the idea of it as a first step is, if we can move the primary care, this local kind of health center, and moving them up as a very local hospital that can take care of the people would be really good. So the idea is really good. However, there is a problem because a lot of, I don't know if everyone else, but Ajahn, of course, you actually used to go to this kind of hospital. Some of the hospital, it doesn't have even a doctor, right? And doesn't have a specialist. And so it's might actually good as those of the preemptive or the healthcare itself that is not very critical. So I guess, so there is a question whether or not if we let them actually be able to grow up on themselves and move, is it going to be okay if move them to be under the provincial kind of level? So that's why not every single one of them can move. So if you ask me what is the criteria is a lot. I think one of my colleagues at Thammasat University has his research on this one of the criteria. I could not remember, I'm sorry. This criteria you have to be met and be evaluate and re-evaluate from the committee to be able to actually transfer themselves to be under the provincial kind of level. So that's why it's like moving on a little slowly. However, if you ask me, what do I think? I support decentralization for sure. That's the whole idea of political science, I guess. Mm-hmm. But I also have problem with this idea a little. I work in disaster risk management, which is perhaps a kind of like sibling with the emergency medical care. But I have one problem. As much as I share up decentralization, but I also know that at the end of less capacity, less competency, it's the death of the people. So I kind of hesitate to say that I have full support of transferring all of them to. I have a hesitation. And I think the process of transferring them is not easy, because the decentralization of this country has been pushing the burden rather than enhancing capacity to get the work done. So to me, it's on the other way around. You're supposed to actually transfer capacity, and we're talking about potential resource. You even actually have to be able to have them be able to create their own manpower, which is we're talking doctor. Their doctor has to earn more than the doctor in the city, actually. And then with that kind of capacity and potential created there first, and then we put the burden to them and help them grow up. But then for Thailand, since that is the other way around, if we don't actually, if we put them there under the whole Ministry of Public Health and leaving them just like only a health center, they're not going to be able to be like taking this medical care by the existing structure. So I think we got caught in the middle way. We can't leave them there because they're not going to be able to improve. And then people who are out there cannot get a primary care quickly and in the really high standard. But then to just suddenly push them to that, they're not at the capacity to do so. So they think that transfer some of them to the provincial. At the provincial body, they have resources and they're big enough to create this potential. But then to move there, now you need both in the same time. You need potential building and you need authority to do that and the capacity. So I think I support, but in a very well-designed slow motion kind of way to make sure that the standard is there first. So yeah, that would be my idea.
All right. Well, thank you so much for your question, Ajahn Kraichat, and also your answer, Ajahn Tavida. I think Ajahn Niramon also has a question for you both. Would you like to just open up your mic and ask? You're still on mute.
ขอบคุณค่ะหาหวีเจอแล้วค่ะเมื่อกี้ขอปิดกล้องเพราะว่าหาหวีไม่สวัสดีค่ะ I have a question first for Ajahn Tavida นะคะ Thank you very much for wonderful presentation for both of you. For Ajahn Tavida, I think it is widely known, and yesterday we highlight a lot that a top-down, centralized, megalomaniac kind of urban projects is out. It's quite out because it's quite expensive, very difficult to manage, and maybe it's not sure that if answer to the needs of locality, especially in the time of the crisis like COVID. So we need something at a small scale, well distributed, and engage more people into this decision-making process. And today you just highlight strategy is based on the area, not function. I totally agree. This is a very, very important, and both Bangkok and district need to have a strategy, good strategy for their district. However, you also highlight today that Bangkok is still very highly centralized. Even we are the only province that, only the city that we can elect the governor, but at the administrative system under is, I think, still very difficult to implement a good governance, not only the health government that you just discussed, but in government in general. Where is highly centralized and an appointment system of the district director. So under this structure, how good governance can be realized, especially when the budget and resources is still controlled by function at the bureau, at the city hall. Like yesterday, we shared a bit about, for example, the need of green public space that can be small but well distributed over the city, ideally every district. But when you look at the budget allocation, one of your last slides about the money allocation, the way BMA spend the money, 1 billion baht in Lumpini Park renovation. And I guess according to our study we shown yesterday, more than 30 districts in Bangkok, we have a very, very low green area per capita, and also the proportion of the area of green area per the district area. So means that it's very difficult to really implement a good governance idea. I would like to know, as you are the from the political scientists, how can you really tackle this problem? Because the bad governance is not, how to say, affect on me as a population here, but also as a profession. It's very difficult to work under this system. Thank you, Ha.
To answer this question of yours, I have 2 different ways to tackle it. I have the same problems as you, by the way. First, which is really idealistic, and I don't know if that can happen. The new governor of Bangkok, the Bangkok governor, need to be a person who really can restructure how Bangkok work. And by really know how to restructure it, is not only have the knowledge, that person has to have a lot of guts. Because changing Bangkok structure, you were talking about bad news for some people. But in order to do that, there is a design of changing this that don't harm anyone in the system, but slowly, practically moving people around. I used to offer this proposal before of restructuring Bangkok, how to manage it. And I said, since they have 20 year Bangkok strategy, and they're going to be under this strategy for the next 15 years from now, it's already 5 years. So I said, why don't you actually restructure the section, the bureau under each strategy? And then streamline it as a strategic structure. And having your deputy governor and your deputy permanent secretary to actually taking care of the link between the strategy that actually closer to each other. As I said, the left and the right hand side, there is a closer relationship through that strategy. And by doing that, it means that the KPI, Thai people are so in love with a key performance indicator. Those KPI can also control budget. And because of doing that, people would stop doing functional work only, because the budget needs to allocate by the city goal. not the bureau goals. I actually offer this kind of system, but one thing that is so difficult, but it's needed, but it's take time. You need to translate city goal to the organization goal and then individual performance, promotion and demotion goal. If this happen, the new generation is already on project-based kind of management. So this kind of thing would actually help them to know that, okay, my work here fit with our organization goal here, and it will help move city goal there. And then if you making this happen, actually people are gonna try to move things as a strategic driven and it's not fragmented. But I already said it's a daydream. And it's need really, you know, when, okay, let's say we have the election next year, let's say, on the mid-year, if we're gonna have it. And then when we have it, the budget year of 2022 already spent almost the end of it. And the proposal of budget 2023 is already decided by the Bangkok system itself. The governor has less to catch on. If I were him or her to come, I will use this first 1.5 years tearing apart and redesign how to move people around into the new kind of structure that can run strategically in terms of agenda-based and area-based. So that would be what really perfect. But then put it there, it's my dream. The second way,
can it be one of the campaign? I will choose.
People can, I have no intention of running yet, but I actually broadcast this policy on the television already.
Yes, because what we have heard now is just like elevated bike
walk
lane, sidewalk, and a lot of things. But actually, I think the heart of the problem is this.
Right.
If anybody is going to put that in the election campaign, the policy, I will go for him or her.
Mega project would not be able to handle, because mega project, as you said, that's the other way around. Mega project is a long term. This is my second answer, which is more practical. Mega project, Bangkok needs some mega project. I'm not going to deny that, because the whole city is not very well planned. The urban planning still need a lot, and sometimes you need structure. I have to agree on that one. It doesn't matter small, medium size, or even the link between medium size structure together. You still need that, and it's a long-term kind of policy. With this long-term, there is no way that one department can get along with, and not only one governor and not one director of the bureau, or even staff in one district. So basically, I think for the mega project together, or whatever that is, you need to make them work together. To make them work together instead of changing this structure, this kind of thing. That's why my last slide is trying to use an integrated budget. With this integrated budget, and this is very scary, because Bangkok and a lot of public agencies translate integrated budget into the way of just making this budget to more than one organization, one bureau, and that's it. And they will use it functionally anyway. No, before allocating that, you have to translate first. What goal would you love it to happen? Under that goal, if you're gonna build sky bike lane, so how long would you need it? And through what district? What district come first? What kind of project that district this would get in what year? And through what function, what bureau? And then make the data, this is really important, make strategic data available for public. That this district got the budget this year to create this. Another year comes by, the other district get this because it's in conjunction, intersection with this area, with this district. And then the other strategy of health, comparing to sky bike lane, the other area, the other strategy taking care of healthy city, what budget do they have? Is they're running in less obesity and city kind of disease kind of thing, non-communicable disease. Are we running that all together? And then make people see one little thing. The area that wanted to be green, even though it's small, haven't been allocated budget yet can see, okay, it's not our turn yet, but it has to this year and next year. If not only the data available that we ask is the city data, the government, the procurement, the buying thing, selling thing, yes, that's fine. To me, I need a strategic development, strategic movement data to be available so that I can see what budget go where and get what result each year, and use that to control that. They have to allocate it through the agenda rather than function, because it's already show what function get what and not getting being done. So I think if we make that happen, that can actually help move a bit, waiting for the structure to be actually redesigned too. It can be short term, no, it has to be medium term and long term plan. So if I were that, I would do kind of this thing.
Thank you, Ajahn Tavida. Just to add up, and I have just a small question for Ajahn Kraichat. I totally agree that the city still need a big project, mega project. By chance, my house in Paris just live next to the largest project, the regeneration project in, I think, after Osman in 19th century. This is the largest project in history, and means that the largest project in France. And by chance, when I was a student in the 4th year undergrad student, how long it was, it is.
Oh, just last year.
Just nothing, just years ago. So I did this as a report for Ajahn Kwan Suong. and how many years after, I just lived next to it. So you see, at that time, the name of the project is Masena Nord, is a regeneration of the rail yard, like Bang Sư, into a quite nice project, a mixed use, a big library, housing, shops, commercial, cultural center, cinema. It has been like almost 30 years of plan and implementation. So I really see it bit by bit like this. Like this is really a big project and with many phases. And I would like to ask you if really possible in the context of administration in Thailand, in order to implement it, they have a many source of budget. It's like a co-budgeting from Bangkok, from Paris City Hall, from the like แดงก็ไม่รู้จะเรียกว่าอะไรแคว้นนะคะอาจารย์ Ile-de-France, and the new kind of the company บรรษัทพัฒนาเมือง is set up by the city, and also a kind of like the railway company. So it's a kind of a implementation by the authority from the city level to national level. Is it possible, for example, when you look at Bang Sư, is it can happen in administrative context in Thailand? Because only Bangkok, or even only straight, how to say, a state railway, I don't think it's possible. But we need to really have a collaboration between, and this kind of system is, you see, happen in Lyon, in other big city, in Bordeaux, in Lyon, in many places, especially the big project. Yes.
Me, right?
Yes.
อาจารย์ใจชาติเชิญค่ะก็พูดเยอะละเดี๋ยวค่อยทีเดียว
Okay, yes, quite complicated and difficult questions to answer in terms of scientific.
อาจารย์เดี๋ยวถามเมื่อกี้ถามอาจารย์ทวิดาค่ะแต่ว่าถามอาจารย์ไกรชาติก็ได้อาจารย์ไกรชาติคะดังมีคำถามนะคะ I have a question for you, especially about the dengue and the city.
Yeah.
Actually, I know the head of department of เวชศาสตร์เขตร้อน I really a big fan of her. I totally agree, and thank you for your very knowledgeable presentation. UDC used to do a kind of a mini study between the relationship of a number of the pathogen of dengue in the city and the underused land. For example, the land under the expressway is like a no man's land. It's not my land. BMA will say like, oh, it's not my land. It's the land owned by the expressway authority. And the expressway authority said, oh, I take care of the expressway. The under is your job. It's like no man's land. So we found a kind of a relationship between like this underused land. So you have a lot of still water, Nam Kang, and a number of dengue pathogens. So we try to understand this. And yesterday, Professor Molang has mentioned about this because it has been asked also when you would like to introduce a kind of a nature-based solution idea in the city. Is it when you plant a lot of tree or grass or like this, it creates mosquito. So sometimes when you go to talk with the public, they say, oh, no, it's a lot of mosquito. It's bring mosquito. So and sometimes I saw there's a news on Facebook like ไม่รู้จันว่านเคยเห็นหรือว่า a big apartment condominium in China has been designed according to the eco design. So they cover the condominium with the plants. But finally, everybody has to move out because a lot of mosquito. So I think this is the question how we do it. But so this is just to share with you. So I think the disease of the tropical climate country like us, I think there's a relationship between this kind of under management, or it's like a vacant land, and also this kind of the number of diseases. So I would like to know if you have the research or anything that we can go and have a look or study about. Thank you.
Okay, thank you very much. Yes, I have a chance to conduct the research with Professor Morong also. Yeah, yeah, 10 years ago, we did the research in the upper north of Thailand, in Nan province, to take care about the patients from mosquitoes. I think, as you mentioned, we found many factors, including the water body that you mentioned. If our house is located near the water body, is also risky for the people, local people who stay there. And as you mentioned, for the expressway or railway properties or belongings, then maybe it's either land that they just mentioned, okay, I will not take care of this one because I take care of the track, the route, but in terms of the responsibility, because that land belongs to you, right? Like in your house, if the health volunteer visit your house and found, okay, you have a stagnant water. I found the mosquito that generate from your jar, your water container. You should take care. Yes, we can use the same concept that to distribute the understanding and the concept to many proponents who have their own land with the idle land. They didn't use it, the benefit from that. But we found a stagnant water body. You should take care because this is the source of the mosquito. Yeah, I think this is one point. Then we need to give awareness and distribute the knowledge, understanding to them to take care because they're belongings, right? And refer to another mention about the condominium that I also heard from the news about in China. In Thailand also, we just distribute and publish our papers about dengue distribution in Bangkok. We compare like delivering, low delivering and also high delivering is quite different. And this is one factor, not only for temperature and humidity, but a kind of delivering in terms of the urban city planning. We need to take care of this also. Yeah, it's a very interesting one. We need to investigate more. There's only one paper that we just did a research and find something very interesting. We need to, maybe we need to talk with Bangkok also. Yes. Thank you for your interest.
Maybe this is a subject that I would like to have a chance to maybe go to visit you and Ajahn Morong later.
Yes.
Thank you.
Yeah, we just visit. We just visit. Sorry, Kanchanaburi to develop our curriculum together about the vector, rodent disease, and myself I take care about environment. We try to understand the linkage or association between environmental factor and the behavior of the rodent or vectors like mosquitoes or rat or bird. Yes. Yeah, you can welcome to welcome.
Thank you.
All right. Thank you so much for your questions and the presentations.
I have to answer,
we have.
I have to answer them.
Would you like to? We have about 5 minutes left.
Okay, I can have it. I can make it short. Ajahn, to answer your question, I have 3 steps to fill. First, when you said that is multiple sources of budget, right? To be able to make these multiple sources of budget be allocated and used together under one project. Can it be done that way? It depends upon the budget itself. Is it earmarked and earmarked? Whether or not you have to have the purpose of using it. And by regulation, some of the public budget, you cannot actually use this in conjunction with the other kind of money. So it depends upon money first. If the money can be used together, step 2. If the money can be used together, you need a unit to do the cost per unit and to the impact. Which cost, with budget come from what channel, what source, using for what kind of result of that same project, so that the accountability of monitoring and evaluation when they inspect the money use of public sector can be done. When that already designed, which one going which to get what impact and result, then you need a unit to taking care of this kind of looking at strategically budget allocation, which I would offer that every public agency, not only Bangkok, has a Bureau of Strategy and Evaluation. Together working with the Bureau of Budget, if they work together and to see, that's why I said we need a big data on strategic movement, not only a big data of the city. We need a budget of city management. And then to see these budgets being used and then to allocate accordingly to the impact of the same project. However, all this can be able to get started if they have time. Public agencies do a lot of unnecessary work, especially document one, and just doing a routine job until they don't have time enough to overlook. Even though they have a lot of expertise and they know what they work the most. If you use a central budget bureau to overlook Bangkok, how can central budget bureau know about Bangkok? You need to use budget bureau of Bangkok, defending how to use this kind of strategic money. They don't have time. So altogether, it's possible for that. Not only the structure that you redesign, you have to redesign the workflow as well.
Yeah. All right. Thank you so much for the answers and the questions and the presentations. We are at 5 p.m., but I feel that this this whole conference is based upon, OneHealth, right? Being that it's both the health of the people as well as the health of the ecosystems and the environment. So I like to sort of end on a good note, I suppose, a more positive note, by asking both Ajahn Tavida and also Ajahn Kraichat and Ajahn Dang, if you would like to also pitch in. How do you see, or do you see any good examples that can kind of encourage us or inspire us to really see the connection between the two realms? Because from what we've heard, the public health sector really focused upon either the preemptive or the cure of the diseases and things like that. on the other hand, we have the environmental scientists and engineers that really just looking at the environment itself and not particularly the health, right? When we talk about One Health, we are really talking about the union of the two. Do you see any kind of inspirational or possibilities of this coming together, especially in the space of the city where we are highly deprived of the environmental factors? If you have anything to pitch in, maybe, you know, it could be tangential as well. Yeah, it would be really nice to sort of end this conference with a more positive aspect, I suppose. Anyone can go, I guess. Yeah, please, Ajahn Kraichat.
Okay, thank you very much. Yeah, I maybe mention about the sentence from Ajahn Tavida that you mentioned to Professor Molong. Do not choose, right? but make use of all. Yeah, that's a very interesting one because from my experience, and right now our system is quite complicated, complex system, and also dynamics. Not only complicated, but dynamics, it changes over time. And then to solve the problem, because there are many problems, one approach might be not enough to solve the problem or to tackle the problem. We need multidisciplinaries work together. I have one idea when I have a chance to join hand with UK and South Korea. And academic terms, we work together, and we the professor got the big funding from the government and invited me to join. I and my student, PhD student, joined at that course. And from the funding, a big money, a big budget, they invite all disciplines, right, work together to solve the problem of mega cities. They use example of the Seoul city as a big mega city, like our Bangkok. They use different approach from different disciplines. For example, okay, you are study political science, you are medical doctors, you are public health, you are engineering. We work together by their view, their context, and the same problems. What do you think? What is your idea? How can you tackle this problem? And we debate, we talk together in different way, in different contexts. But finally, we can select maybe not a best one, a best solution, but it might be better because we concern in all kinds of disciplines. We work together. This is, I think, one approach is also one inspiration for me, from my experience. I think we need to work together as a partnership. Yes.
I see. Thank you so much.
Yeah.
Thank you so much. Yes, Thammasat, please.
I'm positive, even though my voice doesn't seem so. I have 4 points, little one. I think we need kind of concert, not a concert for money. I think we need a synergy of learning. I agree with Ajahn Kraichat that we need to work together multidisciplinary kind of way. Lately I'm using the word transdisciplinary because I believe that multidisciplinary it's somehow you cannot make agreement between discipline and then some of the time compromisation of one discipline to back off a bit so that the other discipline shine. I think that's work really best. However, in order to make people, step one, make people together, and then we need a synergy and we need a simultaneous move from this multidiscipline as a policy first. The policy need to be made multidisciplinary, transdisciplinary, and concerted, and then make it sandbox for pilot project or sandbox, fine. And that just step one. Step two, you need a technical person like Ajahn Kraichat to actually communicate to the society that grab this momentum that COVID-19 is just not only the Chinese tourists coming into Thailand. We are talking about hot air. We are talking about climate change. We are talking about mosquito. Dengue might actually get mixed with COVID. Yeah, that's my word. And with this communication to the society that environment and outbreak, environment change the cycle of dengue, that can make people educated that, whoa, this has to be taken care of together, not just only expect the disease to walk by people. It can come from the other thing, and that can go to environment. Technical people need to communicate both sides because we seem to trust their professionality. That's the other group of the people. And we have two more. One, we need the academic simulation. People like me supposed to start doing data collection of each of the city that make decision on outbreak, on health, on OneHealth through their political decision and lay that out. Who make what decision in what time, in how many dimensions, and get to what result, and compare, so that those political makers and policy makers know that when they make decision, it needs to go together. And then we end with the use of local agent, or small per se in our country, or local volunteer. These people are living in the environment of the local, and then they know how to streamline health and environment into their way of life. And with these people communicate this with the local people, I think we can have the OneHealth culture down there too. So I think that's perhaps make it possible.
All right, well, thank you so much for the positive notes at the end. From what you've both have said, I think the key word is really the transdisciplinary and also communication. Effective communication, both to the population, to the policymakers, as well as to the local agencies, and really empowering all of them to be able to kind of handle and contribute to creating the OneHealth communities that we all live in. So with that, I'd like to give the stage, I guess, back to Kun Thonkamon as our MC. Thank you again, Ajahn Tavida and Ajahn Kraichat, for your very inspiring talk.
Thank you to you too, Ajahn.
Thank you very much. Thank you, our expert panelists and our moderator. Thank you, Professor Kraichat Tantrakarnapa. Thank you, Professor Tavida Kamolvej. Thank you, Kun Pongsak Yingchoncharoen, who's not here now, but thank you very much. And thank you, Professor Wanchantavilatwong. And more importantly, thank you very much for all participants and audience on Zoom meeting, and also who participate on our Facebook Live. And if you feel like you want to discuss or you want to exchange more with us, you can DM us on our Facebook, UDDC Urban Design and Development Center. We would be happy to exchange with all of you. And we have come to the end of our conference now. Thank you for the co-organizers, the Embassy of France in Thailand, the French Research Institute on Contemporary Southeast Asia, or Irasec, Urban Design and Development Center, Chulalongkorn University, or UDDC, along with Thai Health Promotion Foundation. On behalf of the organizing committee, we extend our appreciation to all of your participation. And this is the end of the OneHealth and City Conference 2021. Thank you very much.